Welcome to a Stanford Medicine 25 video on the approach to tremor. The goal of this video is to help you figure out what's causing your patient's tremor. Let's start by reviewing the different categories of tremor. The postural tremor is easy to find by asking your patient to hold their arms out. Causes include a normal physiologic tremor, which can be increased in certain states such as sleep deprivation, too much caffeine or nicotine, alcohol withdrawal, increased metabolic states such as in hyperthyroidism, and essential tremor. This is an actual patient from Stanford Hospital with a history of familial essential tremor. As you can see here, with his arms straight out and held up in the air, the tremor is persistent, as seen better here when zoomed in. Patients with essential tremor will oftentimes have a shakiness in their voice as well. If you listen really closely, you can hear slight variation in this patient's voice. The resting tremor is simply examined at rest. Causes include Parkinson's disease, drug-induced Parkinsonism, and less common supranuclear palsy. Here's a resting tremor in a patient with severe Parkinson's disease. If you look closely, even his left leg has a tremor at rest. A tremor is also seen in this patient's face from the same disease. The third and final category of tremor is the action tremor, sometimes referred to as the kinetic or, for our purposes, the intention tremor, which occurs in essentially any type of movement. Causes include cerebellar lesions, like a stroke or a cerebellar mass, multiple sclerosis involving the cerebellum, or chronic alcohol abuse. And here's our patient with essential tremor demonstrating a normal finger-to-nose exam. As you can see, the patient is being asked to pick multiple areas to reach his finger out and extend it almost fully. One last thing to mention, sometimes many of these causes of tremor can present with overlap. For example, a patient with essential tremor that's very severe can present not only with postural tremor, but also resting and or action tremor. However, together with a good history and exam, you'll have a great chance of finding out the cause of your patient's tremor. This has been a Stanford Medicine 25 video on the approach to tremor. Thanks for watching.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.